It's my life, and it's now or never. Ain't gonna live forever. Just wanna live while I'm alive.
Good morning, everyone. We're about to start the program. I ask that you please come in so we can close the doors. Thank you.
Tall when they're calling you out. Don't bend, don't break, baby, don't break down. It's my life, and it's now or never. Ain't gonna live forever. I just wanna live while I'm alive. It's my life, and it's an open highway. Frank said he did it my way. Just wanna live while I'm alive. It's my life, and it's now or never. I ain't gonna live forever. Just wanna live while I'm alive.
There's no microphone. Good morning. Everybody's coming in. Hopefully you found breakfast in the main plaza. Welcome back to our second day of the Florida Blue Foundation Community Health Symposium and Sapphire Awards. I'm Susan Toller. Want to welcome you. If you've been here, hope you've had a great time. If you're new today, welcome to the conference. So, how was yoga? Did anybody do yoga yesterday or this morning? Excellent. Thank you to Carol Croft and Kat DeCecco for setting that up. It was yoga out on the lawn. Yogurt. Jack ate yogurt. Some did yoga. So, just round of applause. How was yesterday in the sessions? Excellent. Great. Really enjoyed our keynote speaker and our panel and the small talks in the afternoon. And then, again, round of applause for last night. How was last night? Fun? We had a jazz band. Their name is Fernway, and their drummer is Sharon Hackney's son, and they're from Douglas Anderson School of the Arts. So we had them perform, and they were great. But also loved the steel drum and the photo booth and the fortune teller and the caricature, all that stuff. So all of this would not be possible without our great planning team led by Velma Montero Tribble. I'd love for you all to congratulate Velma, and she's back in the back. She doesn't like to, Velma, wave. There she is. We have a great planning team with not only our employees from Florida Blue, but also some community volunteers. So we really appreciate all of their help. You will get a survey after the event, and through email, and we really encourage you to fill that out. We do use your feedback to make next year's even better. So please fill that out when you get it. And then if you were here yesterday, you heard that I'm honored to be a woman with heart with Volunteers in Medicine. I'm wearing the pretty necklace, as you can see, and advocating for Volunteers in Medicine this month. And they had 2 baskets that they were drawing. And so I just wanted to announce that Tanya Lamb with the Tampa Bay Academy of Hope won one of the baskets. And Anthony Sutton with Pine Castle won the second basket. So if you'll go out to the Florida Blue table and pick those up. But our exhibitors, Sterling and some other of the exhibitors, also had lovely door prizes and gifts. And if you left your business card there will be a flip chart out there with your names on it. And please see if you won one of those gifts. And we really appreciate our exhibitors for being here. They'll still be here today, so please be sure to visit those. Now we are going to get started with our keynote speaker this morning, and then we'll have a great panel, and then we'll all culminate with our Sapphire Awards luncheon this afternoon at 12:30. That'll be in the Osceola Ballroom down the hall, and you're in for a real treat to recognize and reward excellence in community health. But right now I'd like to introduce Jason Altmeyer, who will introduce our speaker. Jason is the chair of our Florida Blue Foundation Board of Directors. He's also the Senior Vice President for Public Policy and Community Engagement. Jason.
Thank you all. You all having fun? This is the best one ever, right? So Daniel Dawes, I have to tell you, is one of my favorite guys, and that's the truth. And I'm so excited for him to be here. I have to tell you, he injured his back a little bit over the last couple of days, so he's moving a little slower. But we're grateful that he took the time to come and still made the trip, because the panel that we have coming up is a great panel talking about the future of healthcare and the Affordable Care Act. And we needed the right person to moderate that panel, somebody who had been involved in the ACA and who is a nationally recognized leader on that, and we absolutely found the right guy. So I'm going to tell you about that. Daniel Dawes, he's a healthcare attorney and the executive director of government affairs and health policy at Morehouse School of Medicine in Atlanta. He's a nationally recognized leader in health law and policy and has led numerous efforts to address health issues, including impacting vulnerable populations. That's his specialty. He was instrumental in shaping the Mental Health Parity Act, which makes sure that mental health care is looked at equally compared to physical health care, which was a landmark piece of legislation back in 2008. The Genetic Information Non-Discrimination Act, which makes sure that nobody can use your own medical data and genetic information against you in any way or take advantage or profit from it or misuse it. The Americans with Disabilities Act, which with the amendments that occurred over the last few years, he was very involved in that, and of course the Affordable Care Act. And I can tell you that's true. He really was involved in all of that, because all four of those happened when I was in Congress, and he used to come see me in my office and be part of group discussions, and he really was a leader. And those laws would not have turned out as well as they did were it not for the work of Daniel Dawes, and that is the truth. He founded the largest advocacy group focused on addressing disparities in health care and health status among vulnerable groups in the United States. And the name of that group is the National Working Group on Health Disparities and Health Reform, and it includes 300 national organizations. And they've done a lot of things, but again, with the Affordable Care Act, that group played a very large role in making sure the law turned out as well as it possibly could have, and played an enormous role in crafting it and passing it and making sure that the coalition that existed to pass it in a very close vote all across the country, they were working, they helped to make that happen. Where's my folks from Nova Southeastern? I know y'all are here somewhere. Nova Southeastern, that's where he got his undergrad degree. He's very proud of that. He was born in Miami, grew up in South Florida, went to Nova Southeastern, where he has a degree in business administration and psychology, and he got his JD from the University of Nebraska. So go Huskers. I don't think we have any Huskers in the audience, but we're glad to have you here. Well, do we have one? Well, that's good. So on your table, or when you came in the door, you should have received a copy of his book. He's had several publications on healthcare reform and health equality, but this book in particular has done extremely well. It came out last year. It is the #1 bestseller for Johns Hopkins Press. It's used all across the country at universities as a textbook and a learning book, but it's also just a very popular read, and it's a story that needs to be told, and I think you'll enjoy it. So thank you for bringing those books. I'm going to invite Daniel Dawes to come to the podium, and we are glad to have him.
Thank you so much. I appreciate it very much. Thank you. Awesome. So I think this is supposed to come on. Can you all hear me well? All right. Well, good morning, everyone. Good morning, and thank you very much, Congressman Altmaier, for the generous introduction. I said that I could not be more honored to get an introduction from the Honorable Jason Altmaier. He is someone that I enjoyed working with when he was in Congress, someone who understood these issues. He's a brilliant mind, brilliant policymaker. So thank you again. Appreciate that very much. And I also want to recognize Florida Blue for its leadership in this health equity movement. I have been very pleased from the time that I have learned working with Velma Montero Tribble, who introduced me to the great work that all of you have been doing, the work that the foundation has been doing to really spearhead health equity, to advance health equity. And health equity, for those of you who don't know, is this notion of helping everyone achieve their optimal level of health, every single person in our country. And those of us who are health equity champions are working deliberately and diligently to make sure that we are removing the barriers that prevent groups from achieving their optimal level of health. So again, kudos to Florida Blue, and also want to thank, again, my friend Doug Bartell. I saw Doug earlier, there he goes. Doug and I actually met when I served on an advisory board at Nova Southeastern University to design an MBA in complex health systems. So I got a taste of the work that you all are doing in South Florida, where many of my family members live, and I appreciate what you all are doing for them so they can achieve health equity. And I would be remiss if I didn't acknowledge my colleague, the great Dr. Henry Treadwell. Henri has been working with you all, I know some of you as well, over the years, and she is just a prolific scholar and a champion for health equity. So kudos to you as well. Let me actually start out by saying that you remember when Vice President Joe Biden, former Vice President Joe Biden, on the day of the signing ceremony, he whispered into President Obama's ear. He leaned in and he whispered. And he said, "This is a big expletive deal." Any of you remember that? Well, for those of you who are health equity champions, you know that it's an even bigger deal than I believe VP Joe Biden understood at the time. It is really a big deal because as we were working on the Affordable Care Act, we actually were the group that was fighting the fight, or fighting within that fight, for vulnerable populations. And over the last 150 years, you know as well as I do that there have been policies, public policies that have either provided limited protections or were exclusionary. And every time over the last 150 years that folks were working on various health policies, there was always this underlying effort to push for these vulnerable groups, to make sure that we're taking an equity lens to these policies. Sometimes it failed, sometimes we won. And the ACA really is the crowning gem, the crowning achievement for all of us who have been trying for over 150 years to produce a comprehensive health law. So today, I'm going to look at why the movement to advance health equity. Why was this movement? What is it all about? Who were the key players in advocating for health equity? How were we able to achieve this historic success? What is Obamacare? I tell you, I travel all over this country and people still don't quite get what it's about. And where are things heading? Where do we need to go from here? So I'm going to take a past, present, and future look at the Affordable Care Act. So this is Lady Columbia, or Lady Justice, representing our great country, the United States of America. And for too long in our country, vulnerable populations, the health and well-being of these groups were hanging in the balance. Many individuals finding themselves in a precarious position, right? Unable to access critical health services, preventive services, behavioral health services, and many of them were falling through the gaps, so to speak. So as we were working on the Affordable Care Act, on Obamacare, we envisioned a strengthening and an expansion of the safety net to catch these groups that we have long neglected. So this was the state of health affairs prior to the Affordable Care Act, a state where there were a few of us who were able to achieve health equity, achieve our optimal level of health. able to flourish and be productive citizens. There were some who were barely hanging on, right? And then there were those who were dying prematurely due to disparities in health status and health care. So we had to do something about it. And as we convened this group and we worked with folks in Congress and in the White House to really push this health equity agenda in the Affordable Care Act, we actually reminded them, why is this such a critical issue? So many of you might remember that President Obama, when he was on the campaign trail, he talked about comprehensive health reform. And we said, wow, we agree with that. It should be comprehensive. We should be developing a bill that will address the fragmentation and the inequities in our health system. And these were the statistics, these was the information that we had at the time from studies, from research, showing the disparities among various groups. So many of you know, women, discrimination coverage, charged twice as much as a man for pre-existing condition, simply because you're of reproductive age, right? Or God forbid you were the victim of rape or you had a disability. We know that many women with disabilities had the lowest breast cancer screenings. The medical equipment wasn't accessible to them, and yet they were dying at higher rates of breast cancer, right? And then black women. Black women had the highest death rates from heart disease, breast and lung cancer, stroke, and pregnancy. And what was interesting about this group was, even though they had shown that there was no disparity in terms of breast cancer screenings and access in breast cancer screenings, they were dying at much higher rates. What was going on there? Go figure, the studies show that black women had triple-negative breast cancer, the deadliest form of breast cancer. And many times, these mammography machines were not able to penetrate the dense breast, dense tissues, and get to the cancer. So we wanted to make sure that medical device manufacturers, pharmaceutical companies, and others were inclusive in their clinical trials. We're bringing groups in that had long been neglected. And then when you look at racial and ethnic minorities, we know that there were vast disparities. American Indians and Alaska Natives had a higher suicide rate, 50% higher than the rest of the population. In terms of African American and Latino children, we know that behavioral health services were only meeting the needs of 13% of that group. And even when 13% of that group was able to get some behavioral health, mental health services, it was often of inferior quality. So something had to be done to increase access, increase quality. And then we know with people with disabilities, many people with disabilities with serious mental illness were dying 25 years earlier on average than the rest of the population. We also knew that whites had a higher prevalence of autism and addiction disorders. We had to do something about that. And then when you look at LGBT individuals, we know that the LGBT groups were approximately 2.5 times more likely to have a mental health or substance use disorder in their lifetime, more likely not to seek medical care because they were afraid of being discriminated against in our health system. And many of them had higher risk of cancer, HIV, AIDS, etc. Interestingly enough, too, we found out that lesbian women also had higher death rates from breast cancer because they were concerned about going to their physicians or nurse practitioners or clinicians for care. And so they were dying at higher rates from that. And then there were geographic disparities that we were looking at as we were creating this law. Rural southern communities experiencing higher rates of poverty, smoking, physical inactivity, and deaths. Rural western communities had higher rates of alcohol misuse and suicide. And rural northeastern communities had higher rates of total tooth loss. So what is the impact of health disparities? Why should policymakers care about this issue? Why did it need to be a part of this comprehensive health law? Because it was resulting in 83,000 deaths per year. Okay? And this statistic was only for African Americans. We did not have statistics for the other groups. We didn't have statistics for Latinos, for American Indians and Alaska Natives. We didn't have it for the disability community or the LGBT community. So you can imagine how much higher that number is when you include these other groups. This was actually costing us alone $300 billion with a B per year. And so as the negotiations over the Affordable Care Act evolved, you might remember that the strategies evolved. We were making a moral argument at first saying 83,000 deaths, and it's much higher because we haven't included the other groups. And lawmakers said, oh, wow, okay. But then after a while, when the Tea Party movement was heating up, strategy changed. And folks said, well, you got to show us how reducing disparities is going to actually decrease costs in the system. Thankfully, scholars at Johns Hopkins University and George Washington University were actually tabulating this and actually came up with a conservative estimate that it was about $300 billion per year. We were able to then take that and remain in the game so we could push this health equity agenda forward. And then we made the argument to folks after strategies had changed. We said, this isn't an isolated issue. It impacts the social and economic vitality of communities because if people are dying younger, if they're sicker and they're dying younger, they're not able to contribute to our great country, right? And how in the world can you expect them to outcompete our global competitors? It's a national security issue, we argued. And that again seemed to resonate with our policymakers. We also highlighted a fourth point to make sure we push this health equity agenda, and it's the fact that public policy has been a driving force for many of the inequities that we've observed in the system. So why not use this policy, this proposed policy at the time, to address these issues? So thankfully, lawmakers said, fine, you guys can keep staying at the table, we're gonna hear you out, you're making a great case. And the ACA, or Obamacare, actually was the first first complete health reform policy than we'd ever seen before. It was the most comprehensive and inclusive policy that we've ever had passed by the US Congress, and you're gonna hear why. So how many Bob Marley fans do I have out there? Any Bob Marley fans? Great, love Bob Marley. And in his song, No Woman Don't Cry, he says, in this great future, you can't forget your past, right? Another great philosopher, Aristotle, said if you would observe anything, observe its beginning and development. So we're gonna go back 150 years, and if you don't like history, bear with me a second, because I promise you it's gonna be really interesting. So what did we do during the ACA? Why did the ACA succeed this time? Well, the stars aligned perfectly politically, but it's also because we had brought together these independent campaigns around mental health, minority health, universal health, and others under this one umbrella. Everyone had an ownership interest in this bill. They had their issues addressed to an extent through this bill. And why is this a really big deal for the groups that we care about? It's because of these issues. So let me bring you back, and I'm gonna start with mental health for a second. 150 years ago, you may recall, for those of you who are in behavioral health, that there was a woman named Dorothea Dix from Massachusetts who was a champion for the indigent insane, they called them at the time, for people with mental illness. And during that time, many people, if you had a mental illness, they were often taken from the streets, they were jailed, imprisoned, they were stripped naked, beaten, and handcuffed in their cells, treated terribly. And Dorothy Dix was horrified by what she had seen, as well as other mental health champions. And they went around the country and they worked with these policymakers to say, listen, this is what's going on in your state, this is why you need a care. And at that time, she and other health reformers, mental health reformers, tried desperately to get Congress to pass a bill that would actually reform the mental health system. And it took her 4 decades of her life to finally succeed in getting this done. She did. It was called the Bill for the Benefit of the Indigent Insane. And Congress said, fine, we hear you, we'll pass it. But guess what? President Franklin Pierce at the time, you would have thought the stars had aligned perfectly to push forth a mental health policy. Well, Franklin Pierce and his wife on the day of his inauguration actually experienced a terrible tragedy, a terrible accident. They were coming from a funeral on the day of his inauguration by train. They were with their only child, their son, and the train veered off course, it crashed, and the only person to have died that day was their firstborn. Died very tragically. Skull split open, blood was everywhere, and as you can imagine, as a parent of children, the mother succumbed to clinical depression and anxiety for the rest of her life. Father became a substance misuser and alcoholic, and they could never quite get over that horrible event. So you would have thought that President Pierce would have signed that into law. Well, he did not. And folks were so sure that he was going to be the president to pass a comprehensive mental health reform law. So anyway, in his veto message, one of the longest I've ever read, he set the federal policy of inaction in human welfare issues for the next almost 100 years. So for the next 100 years after his veto, the federal government didn't even want to touch this mental health reform piece. And it wasn't until Truman and Eisenhower and Kennedy and Johnson when you saw more piecemeal mental health legislation being introduced. And then it wasn't until 1980, actually before that, in 1976, when President Carter and his wife, Mrs. Carter, the former First Lady, won the election, and in Georgia they had been huge mental health champions, and decided that they were going to attempt, exactly to the date, 125 years to the date, they were going to attempt to pass comprehensive mental health. And they actually expended all 4 years of their political capital to working on this. They wanted to work on a comprehensive health reform package as well, but you know, they expended most of it on the mental health reform piece. They finally succeeded. After 125 years, they succeeded in getting it done, the Mental Health Systems Act. But guess what happened? For those of you who are around, you might recall that he got it done a month before the 1980 election. And in 1980, President Ronald Reagan won the election, and his administration went about immediately preventing further implementation of the Mental Health Systems Act and dismantling what had already been implemented. And so, can you imagine how much further we would be today in terms of mental health had that law been implemented, but it never got to see the light of day. And before anybody thinks that I'm a Reagan basher, I'm actually going to be singing his praises in Minority Health, so just keep that in mind. Because I've been accused before, and I said, just give me a second, I'm getting there. So on Minority Health, here's what's amazing. And this is what we were trying to do to educate folks about. It is so eerie to think about how history has been repeating itself lately. 150 years ago, after the Civil War, there was an attempt to keep newly freed slaves, primarily African Americans, and refugees who were poor whites displaced by the Civil War, access to health care. It was called the Freedmen's Bureau Act and had a huge medical division. And interestingly enough, the Affordable Care Act was modeled in some respect to that law. But here's where history is eerie. Just like we have seen some escalation of racial tensions today, the same thing happened 150 years ago. And because of that, opponents of that health reform law effort that abolitionists had worked so hard to achieve, they were successful in dismantling that after 7 years. Isn't that eerie? We just celebrated the 7th anniversary of the Affordable Care Act. Very similar to that bill and its purpose. And again, folks were trying to dismantle that. So interesting stuff there. They dismantled it. It was the longest living health reform law that we had on the books until we got to the ACA now. In 1990, though, after that bill had, after that law had been repealed by Congress, President Reagan, the Reagan administration, through Secretary Margaret Heckler, recognized that while the overall health of the nation had been improving, the health of African Americans and other racial and ethnic minorities was alarming to her. And against the wishes of her senior advisors, against the wishes of those who were close to her, she says, we've got to do something about it. And so the Reagan administration convened this task force, first time ever in our nation's history. And they actually looked at this issue. What in the world is causing all of these disparities? It was the first attempt to look at it in a comprehensive manner. And through that was born this task force report that was instrumental in establishing an Office of Minority Health at the U.S. Department of Health and Human Services, actually allocating some of the resources to look deeper into this, to study it. And they did a pretty good job back then, but it wasn't until the late 80s, under the George H.W. Bush administration, that you saw codification of those efforts through statute. And the George H.W. Bush administration actually passed the Disadvantaged Minority Health Improvement Act, along with Senator Ted Kennedy, who was leading that effort in the Senate, and Congressman Louis Stokes from Ohio. And then from there, Senator Bill Frist, Republican of Tennessee, who was a majority leader afterwards, worked with them to even build up on that effort and dedicated millions of dollars to studying this issue. Through those studies, we had over 6,000 studies that were produced. And from there, we took those studies, took the evidence, and we used it to inform our policymakers about why this was a big deal and why it needed to be addressed. So from there, 1990, 100 plus years after the Freedmen's Bureau Act, we were able to get that piecemeal legislation. 10 years later, get it expanded, and then from there, with the ACA, expanded even more to address these issues. On the universal health side, we know about health insurance reforms, and of course, so this is where I argue with folks. I say Republicans actually do embrace Obamacare, despite their rhetoric. So they agree with practically all of the delivery and payment system reforms. Many of these provisions that are looking at data collection and reporting, et cetera, but where they disagree on is that are the health insurance reforms piece, okay? So universal health, folks have been trying since FDR to get it done. Unfortunately, you saw opponents of that effort always trying to infuse race and gender into the debates to undermine the efforts. And so we could only get stuff done piecemeal with some of these other vulnerable populations. Interestingly enough, we decided that, you know what, we really do need to achieve some level of universal health for all of these population groups and provide health insurance coverage to everyone. So interestingly enough, this was the federal government's response, aligning very well with the passage of these landmark bills was an attempt by the Surgeons General of our country at the time. In 1990, it was Lewis Sullivan under the Bush administration who said, you know what, as we develop this nation's public health agenda, we need to recognize that reduction of health disparities is a priority, should be a priority. And so he was pretty bold, even though folks told him in the Bush administration, don't go there. No, we don't want to talk about health disparities. It makes people too uncomfortable. Well, he went there, and he said it's the right thing to do, and he put in reducing health disparities as one of our goals for the next 10 years. After that, David Satcher, Surgeon General and Assistant Secretary under President Clinton, said we've got to go beyond that, and we are going to actually talk about eliminating health disparities, not just reducing them. Because you see, back then, and it's not even that long ago, quite frankly, but back then, in our country, believe it or not, we had separate and unequal standards based on your race or ethnicity in this country. So if you were Caucasian, we would say the infant mortality rate, the lowest of all groups, if it was at 1%, blacks, or say it was 5%, then we'll get it down to 2%. If you were black, let's say it was 10%, we'll get them down to 8%. If you're Hispanic, you're at 8%, we're gonna get it down to 6%. So the Clinton administration, under Secretary Donna Shalala and others, said, no, that's unacceptable. We should have one standard for all groups. We should be trying to achieve health equity for every group. So you see then, in 2010, under the Obama administration, an effort there by the Surgeon General, Regina Benjamin, who said, we are not only going to talk about eliminating health equity, we're going to be really audacious and talk about achieving health equity and improving the health of all communities, no matter what background you are. So with that said, let's talk about who the key players in advocating for health equity were, right? You heard me talk about it was the most comprehensive health law ever developed in our country, most inclusive law ever developed. And it's the most inclusive law, not only in terms of its content, but in terms of the people who were brought to the table to craft this law. And interestingly enough, we had organizations representing virtually every stakeholder in healthcare. It was a group of us representing racial and ethnic minorities, women, veterans, children, LGBT groups, disability, faith-based organizations that were a part of this. And I know I spoke with Jane earlier, and Ascension Health and Catholic Healthcare Association did a phenomenal job pushing this as well. So these are just a partial list of the folks who came together to really push this health equity agenda. And if you're a part of any of them, I urge you to continue supporting them. They were phenomenal in helping us push the agenda. So how were we able to achieve this historic success, right? Let me go back now to more recent history. Back in 2008, when we knew that Senators McCain, Obama, and Clinton were running, we approached all three campaigns and said, what are you going to do to address health reform, right? Everybody says, we're going to do something. McCain says he's going to tackle it, Obama, Clinton, we're going to tackle it. And we said, how about prioritizing health equity within your efforts? And everyone agreed that they would do it to an extent, right? So we were pretty pleased that no matter who won, we'd get a chance to tackle health reform. And more importantly, we would get a chance to prioritize health equity. So let me actually go after the election now to the transition period. We had met with transition team members in the Obama administration, and we reminded them that your boss, President Barack Obama, had promised that he was going to tackle this issue, but he was going to prioritize health equity, that you all were going to take an equity lens to this effort. And folks said to us, no, they didn't want to touch this issue, because they had remembered when we had tried health reform in the past, this issue of disparities, when you're talking about elevating everyone, it makes people feel uncomfortable. And we said, well, that's unfortunate that they feel this way, but if we are truly, again, you remember the 4 points we made earlier, if you're truly going to outcompete our global competitors, if you're going to make sure that we are looking at issues that can elevate folks so they can be more productive, well, you've got to address this issue. It doesn't make any sense. We're #1 in the country for healthcare spending, but 37 in health outcomes, and it's even worse if you fall into one of these protected classes. That's acceptable. So they agreed, and when they were now working on the American Recovery and Reinvestment Act, the stimulus law, we actually recognized, oh my gosh, just in case we can't do comprehensive health reform, let's put as many of our priorities in ARA as we can. And so in ARA laid the foundation for the Affordable Care Act. It actually bolstered our public health and early interventions, dedicated resources to prevention and early interventions, actually bolstered HIT with the Meaningful Use program that many of you know about, comes from ARA. We wanted the IT capabilities because we recognized we'd be able to leverage that to address the disparities in our health system. And then what we did, we also looked at CER, comparative effectiveness research. We wanted to make sure that medical device companies, that pharmaceutical companies, that even consumer groups understood the need to include folks in clinical trials so that the medical device equipments, the drugs, would positively benefit every group. We wanted health reform for all, not reform for some. And that was what we pushed there. And then there were a host of other pieces that we succeeded. And even President Obama recognized that he could have stopped there and said, you know what, I accomplished health reform, check. But against VP Joe Biden's advice, he says, no, we're going to go beyond that, because he recognized that we had so much more to do, especially in the health insurance, with the health insurance reforms, to really push for universal health. So as we were working as a group, and you can imagine, for those of you who work with diverse stakeholders and you're working with this level of incredible diversity, everyone has an agenda, right? They have their personal agendas. And so it was so frustrating at times trying to get every one of these groups to cooperate, to come together and agree to certain principles. Well, we finally did. We'd work till 2 in the morning near to the Senate office by Union Station. And sometimes the trains would leave. We'd have to sleep on the floor because that's how long negotiations were taking place, way into the early morning. Some of us didn't even leave to go home, brush our teeth, much less. So these are 5 principles that we all agreed to that gird the Affordable Care Act. Take a very close look at them, extremely important. You notice I highlight or underline that last piece, which I'm going to talk more about when I get to the close of my presentation. So what is Obamacare? Again, total confusion even to this day. Lots of folks still don't quite get it. But let me tell you, it is really the compilation of 2 statutes that were signed, one right after the other. And there are 2 points that I want you to remember. You've heard me saying this over and over again. Most comprehensive law addressing issues impacting health, disparate groups. And it is the most inclusive law ever passed and produced by the U.S. Congress. Very, very important, we believe. So, throughout the entire law, what we managed to do was to make sure that we got 62 provisions addressing health equity throughout the law. We did not want one title of the law to be the health disparities title. We were careful, just in case the Supreme Court found that part unconstitutional or found another part unconstitutional, we'd be protected. Or should, through the political process, the law be dismantled or be modified to an extent, we would have some health equity provisions throughout there. So in all of the titles of the law, you will find provisions that are pushing for greater health equity. Now, I want to actually highlight the health insurance piece for a second. This is a huge deal, again, like I said, and it's the one when I've been on NPR, and I remember right before the election, folks were pounding on me talking about, my God, the premiums have gone up so high. What in the world? I'm so upset. And, you know, not to get too into the weeds, but there was all sorts of obstruction that was taking place, preventing the insurance companies from actually recouping any losses. So we had talked about risk corridors, giving the insurance companies what they had been promised. There were also additional areas where every single time there was a contentious negotiation with the Obama White House, Congress and the White House, it always resulted in a chipping away at the Affordable Care Act, and you're going to see how that happened. So I highlight the essential health benefits because I understand that's been extremely popular. And this for us was a huge deal for the insurance reforms. We wanted essential health benefits included in this package because, as you heard Congressman Altmaier say earlier, I had worked on the Mental Health Parity Act. And when we were working on that act for Senator Kennedy, we had promised everyone we were just going to talk about requiring that mental health, behavioral health benefits had to be on par with physical health benefits, with medical and surgical health benefits. What we wanted to really do was to mandate the mental health benefits as well as physical health benefits, but we could not do it in that bill. And so we always had an eye to the next Congress. We just knew in 2007 we would have an opportunity to address those issues. But why is this a big deal? You heard me talk about behavioral health. We've been trying 150 years to get comprehensive mental health reform done. We succeeded to an extent in this law. So that, again, is a huge deal for us. The other piece is maternity health. And you've heard people saying, my gosh, I'm a guy. Why do I need to pay for maternity coverage? Well, I always argue it takes two to tango, and you help to produce this child. You should have to pay for this too. So maternity coverage is a huge deal because what we recognized in the negotiations was that 90% of women in the individual market who thought they had maternity coverage only found out they didn't when they got pregnant, when they really needed it. And many of them, as a result, were slapped with bills of $25,000 or more. That's very unfair to these women. So anyway, that was one of the main reasons why we were pushing for maternity coverage and why I am urging you all, when you're listening to these debates, to watch out for those. Huge deal. And then for those of you who may work with people with disabilities, if you have children with a disability or you yourself might have one, rehabilitative and habilitative coverage was huge. Habilitative coverage is if you were born without the ability to use a certain function in your body. Let's say you can't raise your right arm, right? Then you'd be able to access physical therapists or occupational therapists to help you gain a function that you didn't have. Rehabilitative, many of our veterans groups wanted this especially. Many veterans were returning, and guess what? Oftentimes we're injured and we're unable to use a certain function, whether it was cognitive or physical. And so this was to help them achieve some level of, or access to some level of therapy that they need. So huge, huge deal there. So here are some of the provisions when I talk about the health equity related provisions in the law. Last year you heard Dr. Joe Betancourt from Harvard Medical School talk about the health inequities or healthcare disparities. And with his help and with other health equity champions, we were able to take that research, advise folks, here's what we need to do now to rectify it. So we wanted, with the health insurance exchanges, we recognized that there were groups for generations who had never had health insurance coverage. And we wanted to make sure that any health insurance company that participated in the exchanges, the navigators who were helping to conduct outreach, that they understood the unique needs of these communities, that they knew they were culturally competent, linguistically competent. They knew how to reach these folks and get them into the system. We wanted to make sure that any notices that were produced in the, by the health insurance exchange was actually at a level that anybody could readily understand and use, right? Especially those who are limited English proficient. We wanted to make sure that, that they were given notices that were comprehensible. Because I'll tell you, even as a lawyer, it is so difficult for me to understand what some of these notices are saying, much less somebody else, right, who has maybe a high school education or less. So we wanted to make sure that those notices were written as such. Then the data collection and reporting, huge deal for all of these groups, because we recognized that if we didn't have accurate data, we could not track the disparities, and that we couldn't develop the interventions, the services and supports that these communities need. Then we talked about CER, I won't go there. We talked about elevating minority health in the federal agencies. What happened now, and the Trump administration has actually released a letter saying that they will keep the Office of Minority Health. They're going to keep all of these offices of minority health that were established at HHS to make sure that as they come out with rules, regulations, sub-regulations, that they are taking an equity lens to this to understand the impact to various groups. So we're pleased to hear that. There's also this notion if any of you are in healthcare, if you're a clinician, a recent graduate, many of you may have had to take some cultural competency training. You had to take training to understand the unique needs of your communities. That was intentional. Many medical schools, nursing schools, psychology programs, et cetera, received grant funding so they could bolster their efforts there. And then the Prevention and Public Health Fund, huge deal again for us, because this is the largest investment in prevention and public health that we have ever seen in law. And so we were very pleased that we got this funded. Many of you might recall, anybody who watches Jay Leno or any of these late night folks? A few? Okay. So no night owls here. Well, I watch them all the time, and imagine how horrified I was during the negotiations when Jay Leno, David Letterman, and others were blasting the Prevention and Public Health Fund, saying, oh my God, now they want to build jungle gyms and parks? What? Actually, this fund was critical to helping us talk about or address the social determinants of health, to address some of the issues that are so prevalent in underserved communities. And so we've been protecting that, but you're going to see how 4 times now opponents of this law have tried to undermine it. And we keep fighting back because this is a critical funding piece for the work that we're doing. Then there's this non-discrimination provision. So we wanted to make sure that we expanded existing civil rights laws and protections to groups that have long been discriminated against in healthcare. And one group that was very vocal about this was the LGBT community. And we tried our best to get in language that would protect these individuals. And in the House bill, very explicit about sexual orientation or gender identity. And unfortunately, that was stripped away. So we worked and we developed more general language because we believed it would be more inclusive as well. And that made it, that's section 1557. So this is where now, interestingly enough, a judge in the Northern District, the District of Northern Texas, actually said that HHS is enjoined from actually using this to protect transgender individuals, gender identity. So for those of you who work in that community, HHS is not going to uphold the protections for that class of individuals, but they are upholding it for other groups. So racial and ethnic minority groups, women, older adults, et cetera, that still applies. So we can talk about that later if you're interested. And then the list continues. There were 7 national strategies also that were developed that we wanted HHS to use to grade itself on how it was doing during the implementation of Obamacare. So we wanted a national action plan to address health disparities. We wanted to make sure that those of you who are involved in quality improvement activities, that again, you were taking an equity lens to your efforts. And then we also wanted to make sure that those of you who are in the prevention and wellness space, that you too understood the disparities confronting your communities and you were pushing ahead to address those efforts. And then again, health literacy was a huge deal for many of these groups. Many folks didn't even know the difference between going to an emergency room or an urgent care center. We thought that was critical to, again, reduce the cost burden in the system. And then with federal health IT, we wanted these HIT guys and women to really think about how we can leverage that to push our health equity agenda. And then, of course, the last strategy that came out was the Medicare Equity Plan from CMS. So this is where, for those of you who are involved in Medicare Advantage plans, et cetera, you are now required to make sure that you are looking at this issue. So let's close now by talking about where things are heading and where we need to go from here. So since the enactment of the law in 2010, 20.4 million people have gained health insurance coverage, including 1.6 million people here in Florida. So kudos to Florida Blue, who I believe has been leading that effort. More people in the state are getting insured, and it's reduced your uninsured rate from 21% to 13%. Huge deal. So kudos to all of you who have been successful in that effort. And this is the lowest uninsured rate that we've ever had in our country's history. And I'm going to show you how that's worked. 138 million people benefiting from preventive services. What a novel idea, right? Getting people to prevent the onset of chronic disease before it escalates. Huge deal. So we're happy to see that's working. Then 52 million people are protected who have a pre-existing condition are now protected. 7.8 million of them are in Florida. 565,000 patients have benefited from quality programs to prevent hospital readmissions. 2.7 drop in readmissions here in Florida. We could do much better in Florida, and you're going to see why, again, Florida has some work to do in this space. And then again, 125,000 lives have been saved from hospital-acquired conditions. So in case you're wonky like me, and if you can't see it too well, I apologize, but you see over the last 50 years, from the time we've been recording the insurance rate in this country, you see that when Medicare and Medicaid was established, when it passed Congress and states were established, Medicaid, when states were establishing Medicaid, et cetera, you saw the uninsured rate go from 24% down to 14%, so a 10% drop. It declined even more when we expanded Medicare and Medicaid to people with disabilities. And then in the early 80s, it started increasing and plateaued in the 1990s, early 2000s, until we got to the Great Recession. And this is why the president, looking at this data, President Obama recognized an incredible opportunity to tackle health insurance reform once and for all and provide universal health coverage. So notice that we have gone down now 8.8, 8.6% since the ACA has been enacted. So that is a huge accomplishment. And it has benefited every single racial and ethnic group in America. We see almost a comparison between black and whites in terms of the reduction in their uninsurance rate. Asians have had by far the highest reduction. And then we still have a lot more to do with our Latino communities. 35% reduction. We're still doing, I think, pretty well there, but we could do a lot better with the Hispanic community. In case you're interested in seeing how this compares with public and private insurance coverage, the public health coverage is in red, private insurance is green, and the uninsurance rate is in blue. So African Americans doing well there, decrease, we could still do better. Asian Americans decreasing, Caucasians, the same thing, down to 7.4% uninsurance rate, and Hispanics down to 18.9%. So we are moving towards health equity. It is very, very obvious to those of us who are health equity champions, but we do believe it is now in an extreme peril, right? Prior to the November 2016 election, many of you might recall there were 10 brushes with death, I was arguing, that the ACA had come up against. Opponents had used 2 successful strategies to undermine the ACA over those years, using their hearing powers to shed a negative light on it, and then actually using the budget, must-pass budget, to get the White House to concede and modify or repeal certain provisions. And so to date, there were 16 successful attempts to repeal or modify the law. After the election, with the passage of the 21st Century Cures Bill, that actually went up to 17 successful attempts, which we can talk about as well. And here are some of the provisions that they have been going after, modifying, cutting. Notice the Prevention and Public Health Fund. First, they said you couldn't use it for propaganda purposes. We said, oh, we're not using it for that. $6.25 billion cut. Then they said we're going to allocate the funds by Congress. And then last, in the 21st Century Cures Bill, they cut another $3.5 billion. And this is a $15 billion funding pool that was critical. In addition to that, one of the things that I had been working on, this was Senator Ted Kennedy's main priority in health reform. The Community Living Assistance Services and Supports, the CLASS Act, which was supposed to address some of the long-term care needs of our country. As baby boomers continue to age, get older, we recognize that we also had to address the long-term issues, long-term services issues. Unfortunately, that was repealed. We were upset that the White House had agreed to that. We were hoping they would have at least given it a try. But now what they've done is to say, well, let's do a study on it. So that's where we are for those of you who are in long-term services. So now we get past the election, right? And we talk about health reform has had its major brushes with death, continual blows over the last 8 years, And of course, we thought this election proved to be the one that's putting the ACA in extreme peril. But here's why I wasn't as concerned as most people when President Trump won the election. Because, as many of you heard him say, who knew it could be so complicated, right? It's complicated. And this is extremely complicated because you saw how the tentacles of the ACA reach very deep into other health policies, into other statutes. The American Recovery and Reinvestment Act, right? The roots are in there. It'd be very difficult to untie that. Then many of these tentacles also reach into MACRA, the Medicare Access and Chip Reauthorization Act. And let me tell you something. I, along with other health equity champions, were wondering, how in the world, with all of these health equity, many of these health equity provisions sunsetting in 2015, we know Congress is led by Republicans both in the House and Senate. The White House, Obama had the White House. Would Republicans ever agree to actually reauthorizing these provisions? They did. They expanded, they even went beyond the delivery and system reforms in the ACA and expanded those and said, we're going to really aggressively implement these. And Secretary Tom Price actually voted for MACRA as well. So we know that Republicans embrace most of Obamacare, but again, keep in mind, it's the health insurance reforms that they have some disagreements with. And then after that, with the 21st Century Cures Act, we recognized that the ACA was not the end-all. There were still more that we had to tackle in our system and things that we had to rectify with the implementation of the ACA. And so the 21st Century Cures Act allowed us to do that with mental health reforms. We got to really expand mental health reforms now and push that agenda. We pushed this precision medicine agenda, talking about genetics, which you heard earlier with Gina. Very, very happy and pleased that they agreed to do that. So, moving forward, we know what happened with the American Health Care Act. It imploded. Folks are now struggling to figure out how they're going to repeal or replace the ACA. We know that Speaker Ryan has said now he's going to put these on two separate tracks. So Obamacare repeal on one track, and then he's going to look at tax reform and infrastructure development on another track. But he did declare that Obamacare is the law of the land, and then he said ... for the foreseeable future. But we believe it is here in some form to stay. The repeal options, many of you might recall, repeal and repent. Many folks were really pushing that notion, made us extremely alarmed. With that one, thank God, folks have gone beyond that strategy. Then there was talk about repeal and delay. Again, glad they've gone beyond that. And then folks have been on this repeal and replace strategy. But I am hopeful that we've now come to this fourth strategy, repair and build. Because you see the heads of key committees, both in the House and in the Senate. Lamar Alexander from Tennessee, Senator Alexander. We have folks there who chair, Republicans who are chairing the House committees, who are leaning to repairing and building. And I think this experience with the American Health Care Act, with that bill, actually has caused more to now lean into this camp. And we will continue to work to inform policymakers why that is the best strategy. Okay, and then of course there's some ideas that many in our group have been pushing. Okay, so President Trump on health reform. Again, I see opportunities. I always see opportunities. I see the glass as half full. He said, we need to reform our mental health programs and institutions in this country. So we know mental health reform, we're gonna have an opportunity to really tackle those. And then we need to improve the quality of care available to all Americans. So again, with that notion, let me bring you to my final point for all of you in Florida, why this is a big deal. So you heard me talk about the 5 principles girding the ACA. Improving quality was one of them. Through Surgeons General reports, through the President's New Freedom Commission report in the George W. Bush administration, and reports by the National Academy of Medicine, or formerly the Institute of Medicine, they all were looking at this issue of quality and disparities. Why is it a huge deal? Okay, because healthcare should be safe, effective, patient-centered, timely, efficient, and equitable. But many folks in the quality space focus on the first 5 variables, and they always neglect that equitable piece, that it should not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status, right? But here are the disparities in care. Folks who are lower socioeconomic status individuals, whether you're white or black, brown or red, this is they actually receive the worst care. for 60% of quality measures. We've got to do more to help those who are lower income. Blacks, Hispanics, American Indians, and Alaska Natives receive worse care for about 40% of quality measures. And Asians receive worse care for about 20% of quality measures. And in terms of disparities in quality of care, they're very similar to disparities in access to care. But the disparities are more common among measures of person-centered care and care coordination. So remember that as we're pushing this agenda. These are some of the disparities that have been eliminated to date, some of the disparities that are worsening. Notice that there's this behavioral health component, social determinants of health component that needs to be addressed. So here's my point in closing. Improving healthcare quality does not necessarily reduce disparities for racial and ethnic minorities and other underserved populations. This is according to the Agency for Healthcare Research and Quality. Here is why, for those of you who are visual and need to see how this has worked. Notice the map, two maps, healthcare quality scores nationally and the healthcare disparities scores nationally. Look at Florida. Florida is very interesting because the highest quality scores are generally those in the northern Midwestern states. They tend to have the highest quality care. In the South, we tend to have lower quality care. We've got a lot more to improve the quality of care that we provide patients. But notice on the right that those in the northern areas, the Midwestern areas of our country, actually have the worst disparities in care, even though they have the highest quality care. And those of us in the South, with the exception of Florida and Mississippi, tend to actually not have any disparities in care. So Florida, we need you to work harder to improve the quality of care and to address the disparities in care. Huge, huge deal, because you heard me say the Trump administration agrees with the Obama administration on these delivery and payment system reforms, and they're going to be pushing aggressively to improve quality, lower costs, et cetera. So here are my last points. Health reform in some form is here to stay. I do believe that, but there is a real threat to some of the health insurance reforms and a few of the key health equity provisions. We do believe, as we approach the debt ceiling and sequestration, all these things, that the federal budget is going to continue to pressure healthcare cost reduction. You're going to see more emphasis on really toning that down. And we believe, though, that this focus by policymakers on states really provide a focus and an opportunity for us to leverage that with Medicaid expansion, payment reforms, cost containment, et cetera. And then I do believe that we're also seeing a greater acceptance of the health equity agenda, especially with focus on population health, behavioral health, and the social determinants of health. So you recall, this was the state of health affairs in our country, right? What we had seen. Inequities, disparities, fragmentation in our system. Very few people able to achieve optimal level of health. But as we were working on this law, this is what we envisioned for every single group. An opportunity for everyone to flourish, to achieve their optimal level of health, and to give back to our society. So I want to thank everyone for your diligence and attention. Thank you, everyone.
One more round of applause for Daniel Dawes. We are now going to ask the one and only Susan to, maybe we're not going to, what are we going to do?
Thank you, Jason. Daniel Dawes is going to be the moderator for the panel, and we will hopefully have time for questions at that time, and so he'll be around as well. We're going to take a break right now. We're going to come back in here at 10:45. It's a super quick break. We just need to reset the stage, and be sure to check out your exhibitors, but be back here at 10:45 for an awesome panel about the Affordable Care Act. Thank you.